This video is the lecture for the film Matchstick Men, the 2003 film directed by Ridley Scott, for PSY 300, Movies of Madness. This film, as I said, it was directed by Ridley Scott, was based on a novel by Eric Garcia of the same name. The film stars Nicolas Cage, Sam Rockwell, and Alison Lohman. The script was written by Ted and Nicholas Griffin, who are brothers, and they had acquired the script. They were looking for something they could work on together, and they had acquired the script when the novel was out in galleys prior to its release. In looking for information on this film, obviously my interest in the film is that you have a depiction of a person with a mental illness, in this case specifically obsessive compulsive disorder, which tends to, just as a group of disorders, disorders related to OCD tend to be treated in a fairly specific way in films. And I was interested in finding a film that you could work with as students to kind of get your head around the way in which OCD tends to be used in film. A little bit more background about the film before we dig into the details. The film premiered at the Venice International Film Festival in 2003. Its popularity was modest by some standards. Critics tended to be fond of it in some ways, not fond of it in others. But it has found its own niche in terms of popularity. It was often seen as being overlooked because of other films that came out the same year and that had received far more buzz and more interest, particularly in the United States. In a review written by Dr. Joyce Almeida, who is a psychiatrist who writes a blog called Minds on Film, doing some of the same kinds of work that you've been doing all semester, thinking about these movies, she argues that in the presentation of this set of characters, where you have a main protagonist who's a con artist, Roy, who is experiencing both Tourette syndrome and OCD, that she identifies two main themes, and I'm going to be touching on these themes as I go through both parts 1 and 2 of this lecture. And the two themes are, first off, you've got this story of con men. You have the unexpected twists and the final sting. But the one theme is that you have a very personal story of a man who's coping with a serious set of challenges, not the least of which is the fact that he's dealing with OCD. And then he's also going through this transformation in terms of his personal life. So you have not only the clever story with all the twists, but you've also got this deeply personal story of trying to find a meaningful life in the face of adversity. I'll have more to say about Dr. Almeida's impressions of the film in a bit. She also mentions that there's a characterization of a quote-unquote psychiatrist who is part of the con, and that brings up other issues that we will need to explore, because there's often, I don't know why it is, but there are often in OCD films depictions of mental health care providers who sometimes are pretty shady. So we need to think about why that is in these depictions. Now, OCD is not something that we don't see fairly regularly on screen. Certainly not as common as, say, presenting psychopathic killers on screen. But over the years, we do have some very, very memorable characters showing up as being diagnosed with or strongly implied as having OCD. So on the left here, you have a scene from The Aviator where you have Leonardo DiCaprio playing a wealthy innovator, inventor of many things, but he's also just completely crippled by OCD. On television, you have the TV series that was very successful and critically acclaimed called Monk, where you have a characterization of a detective who is abrasive and rude and often just generally unpleasant, but he's brilliant. He's incredibly smart about solving crimes in a fairly generic television sort of way, but he's also presented to you as a person with fairly profound problems with OCD, although as the series wore on, the depiction got less and less focused and less accurate with time. And then on the right, you have As Good as It Gets with Jack Nicholson, who plays a successful writer who, again, is rude and abrasive and has horrible social attitudes. He's racist, he's sexist, he's homophobic. He even tries to throw that tiny little adorable dog down a trash chute in the opening scenes of the movie. In all three of these cases, of these characters with OCD, you have men, and that's not insignificant. Most of the characters that we see on screen who are depicted as having OCD are in fact male characters. They're almost exclusively white male characters, and they're shown most of the time being quite germophobic and fastidious, very rigidly so. And you have to start asking yourself some questions. Why would the depiction of men as OCD characters be in that particular mode? And we'll come back to that later in the lecture. But very frequently we see these characters. Now, in recent years, I have started to see more depictions of female characters with OCD and related conditions. And I have started to see, although it continues to be rare, and more focused on Tourette's than on OCD by itself, I have occasionally started to see some people of color be represented. But still, the overwhelming number of characters, they tend to be male, they tend to be white, and they tend to be expressing OCD in a particular form of hyper-perfectionism, which is not necessarily a component of OCD itself, germophobic traits with an overemphasis on rigidity and cleanliness. Now, in The Aviator, you do have a departure from that with the character's general decline over the course of the film. But nevertheless, that is the characterization we typically get. There's also a tendency in these films for the characters to start out being very, very difficult, often overtly unpleasant people, and sometimes, as with the case with Matchstick Men, people who break the law. And that's an interesting dynamic to build into these characterizations, because typically the solution to their suffering is to stop being bad people, essentially. Now, Tourette's, which is the secondary disorder, and surprise, I don't know whether this is surprising or not. It was surprising to me when I did some more research into the making of the film. It was actually Nicolas Cage who suggested adding Tourette's-like tics to the character Roy, because in the novel he is not presented as having Tourette's, but Cage suggested doing that. Now, Nicolas Cage is a very physical actor. He has one of those, they used to be called plastic faces, where he can do very interesting things with his face to create interest and for comedy. So he suggested adding tics as an additional kind of feature. And part of that, one of the things we find with Tourette's is that it's often used as a way of kind of signaling in very overt fashion that you have here on screen in front of you a person who has a mental illness. With OCD by itself, it's the behaviors that take center stage. Adding a tic, very much in the way that we saw with the film Joker, with the compulsive laughter, where you have something obvious that at a distance signals to other people who are looking at your character that there's something wrong with them. So it's interesting that Cage suggested that addition and then used it. Now there have been a number of films more recently than in the past. Like when I first started teaching this class, there was literally one film, this one in the center image here, called The Tick Code, that featured a real rarity. You have an African American, Gregory Hines, playing a musician with Tourette's disorder, and then his friendship through his mother with a child also with Tourette's, who is struggling to figure it out. Now that was a real rarity. Not only do you have a person of color as a major character in a film, but also you have this interesting dynamic between an adult and a child with the same problems. Last year, or maybe it was 2018, it was either 2018 or 2019, you'll have to fact check me on that. Motherless Brooklyn came out. This is another film that's based on a novel of the same name. And here you have a detective who has Tourette's, and it's fairly severe, and he nevertheless, perseveres and is able to do his work despite his disability. A more recent even film, and this is a film that includes some coming of age drama. It's called The Road Within. It's not very well known, certainly doesn't have any A-list stars in it, but is available on streaming. Now typically with Tourette's, and it's hard to draw some kind of typical conclusion, most of the films that present Tourette's also have a character with OCD. Now the three that I've put up here don't necessarily fit that mold. In my search for films, I'm always looking for them. The characters do tend to have some OCD features, but clearly Tourette's is the major focus, driving the way these characters are constructed. Now, before we get into kind of the details of the film, I want to spend some time, kind of the remainder of part one of this lecture, thinking about how OCD tends to be presented in media. And I'm drawing all of my information here for this component of the presentation from Fennell and Boyd, a research article that they presented in 2014. Their argument, and I agree with them, different mental illnesses don't carry necessarily with them the same set of stereotypes. Now, when I started this class with you, there was that set of kind of standard stereotypes that tend to be attached to characters with mental illness in general and people with mental illness in general, and those still stand. However, there are deviations. When you break it down and you look at specific types of mental illness, there are some deviations from that, and OCD is one of those cases. So you're not going to see the same tendencies toward really vivid graphic violence that you might see, say, with a character with schizophrenia, in terms of stereotypes. So some representations of OCD do fit what Fennell and Boyd call the psychiatric picture, which by that what they mean is that there's an accurate fit between how the DSM, for example, or the ICD-10 would describe the features of a person appropriately diagnosed with OCD or related disorders. At the same time, though, while they may hit the bullet points of that psychiatric diagnosis, they often are highly stereotyped and don't have a lot of complexity. So they don't often represent the full kind of range of an individual in real life experiencing OCD, and they tend to center on the most stereotypical versions of OCD that an audience would be familiar with. And that includes kind of crossing the lines between OCD as a disorder, and the personality disorder, obsessive compulsive personality disorder, which is a completely distinct phenomenon but has a highly confusing similar name. So the elements that we tend to see in these characters of perfectionism and being controlling, those are elements of the personality disorder, but they are not typical of OCD itself. So we have a lot of that going on in these presentations. Media representations often show a very limited range of possible elements of OCD. So we have some of the subtypes, such as being concerned with contamination, being concerned with disease. Those tend to be represented much more frequently than other types of obsessive thoughts, such as counting or obsessive thoughts of disaster and so on. Those elements are much less likely to be presented. As I was mentioning before, with thinking of the psychiatric picture, far too often we see this, what Fennell and Boyd call conflation, meaning confusion between obsessive compulsive disorder proper and the personality disorder, obsessive compulsive personality disorder. For example, with the TV show Monk, you have Adrian Monk is presented to you as being rigidly, absolutely rigidly perfectionistic in his life. He wants absolute clean. He wears the same clothing day after day. He has multiple copies of the same clothes and the same outfit. He wants everything completely straight and orderly. That perfectionism, and his emotional response when someone violates his perfect order is anger, not fear. It's anger. So that is an element of the personality disorder, where people are excessively punctual, excessively perfectionistic, excessively orderly, and they become upset and angered by people who interfere with that, and they take joy in creating that kind of order and perfectionism. In contrast, with obsessive compulsive disorder, people are genuinely fearful of having the things that they're obsessed with come to pass. So for instance, if a person has a contamination fear and a contamination obsession, the thought of, say, touching a dirty sink or toilet, the mere thought of that is enough to induce symptoms of panic and extreme fear. Hence avoidance and then compulsive behaviors that are designed to combat or reverse that fear. So they're very different. And I'll leave it to those of you who've been assigned these disorder cards to make that really clear to the whole class when you do your disorder card videos. In addition to this confusion between OCPD and OCD, you have a tendency to really just have this very narrow bandwidth of expressions of both the elements of OCPD and OCD. And the challenges that people face are often, minimized. So what you end up like with the TV character Monk, and to some extent for the main character Roy in Matchstick Men, you have a tendency to have these people be able to accomplish really great things. Like Roy is able to bilk people out of lots of money. It's a bad thing, but he can do it. And Monk, every week in the TV series, Monk was able to, figure out the crime despite his limitations and overcome them. In real life, people with real obsessive compulsive disorder find their challenges to be far more significant and in many cases much more disabling. So it's not that you can't just like pull yourself together and solve the crime like Monk does. It's far more disabling than that in real life. Fennell and Boyd go on to talk about some of the common stereotypes that show up in the media representations of OCD. Um, they also kind of highlight in their article that there are particular stereotypes of OCD. So in some cases, the generic um, stereotypes that you're already familiar with of all people with mental illness are magnified in people with OCD, such as being unpredictable or childlike, for example. But then there are also these more particular to OCD stereotypes. So characters with obsessions and compulsions um, are not always treated as if they need to have therapy. Now, in more recent films, and Matchstick Men is one of those, although you have the plot twist of the therapist being fake and part of a con, um, you, if you take the whole genre and look at people with OCD as they're presented in film and television broadly, while a few, like Monk, is shown repeatedly engaged with a therapist, in most of these films they are not shown to be actively working with a therapist and having it make any difference for them. OCD characters that are presented in media are typically, as I described on the last slide, pretty high functioning, meaning they're able to work in one way or another and to succeed. They're often shown effectively kind of overcoming their issues and being largely successful, as opposed to being homebound or disabled. People with OCD were represented if treatment was described. So for instance, in the TV series Monk has a relationship with a therapist, but given, especially in the first couple of seasons, given the degree to which he continues to be troubled by his behavior, you're led to make the inference as the viewer that he's not benefiting from treatment. In fact, there was an episode at some point in the series where he starts to take medication, and what the writers chose to do was to have his personality completely modified after starting his medication, and then it's presented as a bad outcome to have this dramatic transformation, which is totally unrealistic. It's not how the medication works. But he's then shown, getting rid of the medication and going back to his quote-unquote normal self. In the study that they conducted, and what they did was to look at movies from a content analysis perspective, they found that half of the movies that they looked at did show personal friendships, intimate relationships that had a therapeutic effect. So instead of showing treatment or a positive relationship with a therapist, engaging in actual types of therapies that you would see for people with OCD. Like, I've yet to see a film or a television show that really depicts in a fictional story the use of exposure response prevention and CBT. That's the gold standard treatment for people with OCD, but it's not shown in film and television. What you see instead is talk therapy, where one person sits across a room from another person and they talk about their issues. So that is not the gold standard treatment for OCD. It's behavior therapy and cognitive therapies. So what are they doing instead? They will show, rarely medication, often they will show that it's the person's close personal relationships that make the difference. So in As Good as It Gets, the main character, Melvin's relationship with the girl of his dreams improves him. Medication is a part of that improvement picture, but without the woman that he's interested in, he would not have started taking the medication in the first place. In in Monk, the catalyst isn't necessarily, having, the perfect love relationship. It's two things. The friendship he has with a couple of other key characters and solving his wife's murder. That's what moves him toward healing. So instead of really looking at the benefits of accurately depicted therapies, they're using some pretty traditional tropes about love and friendship being the key solution to a character's problems. They also report, Fennell and Boyd that is, that characters with OCD were very, very often being shown as narcissistic, egotistical, and insensitive to others. And also, just really struggling until some big plot twist with having their relationships go smoothly. So in Matchstick Men, you have Roy, who self-discloses that he hasn't been in an intimate relationship with a woman in over a decade. He hasn't a clue what to do with this girl who's shown up in his life. He has this friendship, but it's a very businessy friendship with his partner. Other than that, his life is pretty devoid of personal interactions and personal relationships. So you're left seeing that. In the TV show Monk, Monk is very egotistical, very self-centered, very insensitive to other people's feelings. He knows what those feelings are, but he doesn't seem to care. And he's presented as largely believing that the world revolves around him and his issues. So that presentation is pretty typical in films and television shows about OCD characters. Characters are frequently presented as being unpredictable. Over half did include some physically aggressive acts. Rarely you have, well, about half had aggressive acts and or some sort of criminality. Now with Matchstick Men, you aren't given a person who's really physically aggressive. He gets shouty every now and then, but other than that, he's not physically violent, but he is a criminal. I mean, he bilks old ladies out of money. He's a con artist and a criminal, committing pretty egregious acts. The key solution to his problems is to give up being a con man and fall in love and become a father. Characters are often presented, and this is in contrast to many other depictions of different types of mental disorders. OCD characters are almost always presented as very bright and very independent. Occasionally, you'll have these characters depicted as stocky. They may become obsessed in a kind of sexual way with another person, or obsessed in terms of shared interests. But often it's, if it's going to happen that you have stalking depicted with an OCD character, it's almost always a male character who is obsessed, romantically obsessed with a female who is out of his league. So the stalking behavior becomes obsessive. Now, if you look at the clinical literature about OCD, stalky behavior is not one that rises to the level of being included as a diagnostic criteria. It's simply not typical. These characters almost always are played for laughs. So they're presented to you as the audience member as being, neurotic, as being funny, as getting into all kinds of weird situations that they have difficulty getting out of. I mean, there's a scene in the early seasons of Monk where I remember Monk having to go down a manhole. Here's this very germophobic, neat, tidy, clean man, and in order to solve the crime, he has to go down into this manhole. He gets covered with sewage, and he's surrounded by rats. But it's funny, and it's, seriously funny. So these characters are often played for their comedic value. The situations they get into are often odd and funny and bizarre, and routinely they are shown, these incremental improvements come from situations that have made the audience laugh, and that becomes problematic in terms of stereotype presentations. Characters are often ridiculed by others, and you see this in Matchstick Men very clearly with Roy's partner, who teases him, who intentionally gets dirt on the carpet, who doesn't take his shoes off even though he knows he should, by opening the blinds when he knows it will trigger him. He does all kinds of little digs that are designed to make fun of this person who you think is his partner and his friend. So it makes it have a very high school kind of feel to it. In their examination, in Fennell and Boyd's examination of this whole group of films, that tended to be thematic, that there were people in the film, and some of them are friends and family members who are making fun of them. And it's kind of presented to you as a normal part of this person's life. And in other ways it can be like, when Roy is made fun of by his partner, you as the audience member, you're being given permission then to kind of laugh, but also you're simultaneously being made uncomfortable by that laughter. Also, they noted that characters with obsessions and compulsions were sometimes shown being victimized by mental health professionals. Now, in Matchstick Men, that's kind of convoluted because you come to realize at the end of the film that the so-called psychiatrist wasn't a real psychiatrist. He was a part of the long con that was being played on Roy. So he's pretending to be a psychiatrist because he looks psychiatrist-y, I guess. It's not an accident that he can't prescribe him actual medication, that he prescribes him fake medication. But in Roy's mind, he is being victimized. Now, in other films, there are situations where OCD characters are taken advantage of, they're stolen from, they're abused, they're pulled into situations that they can't control, and so on. Now, I put this whole long quote up here. I'm not going to read the entire thing to you. I will make sure that the Fennell and Boyd article is posted for you on D2L. But when they talked about Matchstick Men, they talked about how the depictions were stereotypical. Now, this quote is from one of their research subjects. So one of the elements of their work was to get open-ended responses from people with OCD in terms of their impressions of the films. So this was one of their participants who is a person with OCD who's talking about Matchstick Men. And this particular person was fearful that Matchstick Men would give people what he says is the same old idea regarding OCD, that it's all about cleanliness and symmetry. And he notes that he wants to see characters with full-blown OCD and some of the depression that often comes with it. Someone with fears that they will hurt other people. And that's something that, given our media representations of OCD, we almost never see. But many people with OCD have these flash images of themselves doing horrible things. And then they experience fear thoughts as a result, and the need to, very scrupulously perform compulsive patterns in order to try and reduce that fear and panic. That's real OCD, as this research participant notes. So what his worry is one of the same worries that I have when I look at OCD presentations, where in fact you're being given permission as an audience member to laugh at people who do strange things. The fact that Nicolas Cage wanted to add facial tics and vocal tics to the character exacerbates that effect. So that concludes part one of my coverage of Matchstick Men. When we come back in part two, I'll talk about the film specifically.